I'm Shannon. I'm a lactation consultant from the Grayson County WIC office.
And I'm Natalie. I'm a lactation consultant from Texoma Medical Center.
And we are 903 Lactation. So we had a meeting on Tuesday night, and these are some of the questions that we had. Shannon, can you tell me what a plugged duct is?
A plugged duct is actually an obstruction of a milk duct, and this is an example of milk ducts in your breast that can have milk stasis or an obstruction of milk in them.
Can you tell me some symptoms?
Sure. You will have a little bit of breast tenderness, very light touch in your breast, and you may feel an actual little lump in your breast tissue. You may not feel great. You may have a very light fever as well.
We know what it is. How do we get relief from it?
So you want to let out a little bit of milk by hand expression before breastfeeding. That may help. Lightly massaging the breast tissue on the lump, and I mean light. You'll hear some discrepancy on, used to it was vigorous, now it's very light as a feather. Removal of the milk towards the nipple.
That's great information, Shannon. Can you show me an example of the massage I need to do?
Okay, so in this example of a breast, there's actually a little lump here, so I would just very lightly and just like running a feather over your breast tissue and rub it towards the nipple to express the milk out of that duct.
Awesome, thank you. What are some things that would cause me to have a plugged duct?
Some things that we have seen that with infants is if the mom is not putting the baby on the breast quite as often. So maybe baby has started started baby foods and not coming to the breast as often. Maybe mom has gone back to work and she may not be pumping as often. Wearing a tight-fitting bra. I have seen quite a bit. It's a tight-fitting bra where it cuts into the breast tissue. Also, sometimes when moms are pumping or breastfeeding, they may be putting too much pressure and can put their fingers in a position that it can cause the milk not to flow. Natalie, what are you seeing at the hospital as far as plugged ducts?
I'm seeing a few that when moms are wearing the wearable or the portable pumps, if they're not using a stretchy enough bra, it can put some compression on the breast tissue and it doesn't allow for complete breast drainage with your pumping session. So incomplete draining of your breast during pumping session can cause that.
What's the difference between a plugged duct and mastitis?
Mastitis is actually swelling and redness caused by inflammation of breast tissue, and it sometimes can involve an infection. There's redness on the breast tissue. You're going to feel quite a bit more fever possibly. You're going to feel achy, maybe flu-like. You're just basically not going to feel well. You're going to need some help with that.
Are there any other treatments?
Yes, you can actually use cold compression. Before we told moms to use heat, and now they're saying cold is the recommended treatment. As well as speak to your doctor about maybe an anti-inflammatory medication to help with the inflammation inside the breast tissue.
What is the difference between the treatment for plugged ducts and mastitis?
We have already gone over things to help with plugged ducts, which is where your mastitis could start from. So you want to continue doing that protocol that we talked about, as well as making sure to empty your breast, stay on a pumping nursing schedule. Positioning the baby could be very important, and reach out to a lactation consultant because we can give you tips on different positioning to help with making the milk flow easier. And then always reach out to a lactation consultant or your healthcare provider.
Okay.
Thank you for joining us for our 903 Lactation Support Group. We look forward to meeting with you at our next meeting. They are every second Tuesday of the month at the Denison WIC office.
And what time are they?
5:30 p.m.